Why do CF lungs get inflamed without infection present? Imagine your lungs filled with thick, sticky mucus that clogs the airways. In cystic fibrosis, this mucus buildup is a key feature, but inflammation can happen even when no germs are present. This is because the disease causes changes inside the lungs that trigger inflammation on their own. When mucus blocks airflow, oxygen levels in the small airways drop, creating a low oxygen environment called hypoxia. This hypoxia signals the cells lining the airways to release inflammatory molecules like interleukin-1 alpha and interleukin-1 beta. These molecules promote inflammation and cause the mucus to become even thicker, making it harder to breathe. The cells lining the lungs and the immune cells like neutrophils and macrophages are also affected by cystic fibrosis. The faulty CFTR protein causes these cells to become abnormally active, releasing too many inflammatory substances such as interleukin-8, tumor necrosis factor alpha, and interleukin-6. These substances attract more immune cells to the area, which releases enzymes and reactive oxygen species that can damage the lung tissue. This process happens even without bacteria or other microbes present. Neutrophils are especially important in cystic fibrosis lung inflammation. They are the first responders, rushing to the airways early on. They release enzymes like neutrophil elastase and produce reactive oxygen species that can harm the lung tissue. This neutrophil-driven inflammation can become chronic, leading to tissue damage and scarring over time. The cells lining the airways are not just passive barriers. They actively produce inflammatory signals when they sense the abnormal mucus environment. Their response amplifies the inflammation, creating a cycle where inflammation leads to more mucus production, which in turn fuels further inflammation. This cycle keeps the lungs inflamed even when no infection is involved. Managing this sterile inflammation is a major focus of treatment. Anti-inflammatory drugs aim to reduce the excessive immune response, protecting the lung tissue from damage. Controlling inflammation early can slow disease progression and improve quality of life for people with cystic fibrosis. In summary, lung inflammation in cystic fibrosis without infection happens because the abnormal mucus, low oxygen levels, and dysfunctional cells all send signals that activate the immune system. This leads to inflammation that damages the lungs over time. Understanding this process helps guide treatment strategies focused on reducing inflammation and preserving lung function. Always remember, if you or someone you know has cystic fibrosis, consulting healthcare professionals is essential for personalized care and effective management.